we're going to talk about suctioning your patients, and what we're going to do is do a quick review of the equipment that you're going to need in order to provide suctioning therapy. So the first thing that you're going to need is a suction regulator that will attach to your Medivac or your suction outlet on the wall, which is typically labeled yellow, as it is here. You're going to need a hose going to a suction canister, so where we can collect all of the sputum that we may be suctioning out of our patients, as well as the insert or the liner and your 7-foot suction tubing right here that's attached to the top. In terms of setting your suction regulator, you want to make sure that your suction is set to reg or always on. And then you want to adjust your pressures depending on the size of your child. So if it's a neonate, we typically recommend ranges of 60 to 80 millimeters of mercury of suctioning. The older the child gets, probably anywhere between -80 and -100 millimeters of mercury for suction. So right now we're just below 80. So I'm going to adjust that so that we're around 80, and then as I include my suction, it's a little bit too high. We want to stay in the medium range here, so I'm just going to dial that down. Once I remove suction and apply it back again, just to test it, we're now back up into 80, between 80 and 100 for our appropriate suction level. So first we're going to talk about open suctioning. So we've already reviewed the equipment on the wall, and then if you need to provide open suctioning to your patient, we have these individually wrapped suction catheters that come in size 6.5 French, 8 French, 10 French, and 12 French. Some hospitals also do have a 14 French as well that's available to you. So if your patient is requiring suctioning, they are breathing on their own, but they're having an inability to clear their own secretions, we may need to provide open suctioning therapy to them. We have a patient here who has an ineffective cough and has difficulty clearing their secretions, but we don't have an artificial airway in place. So we want to help facilitate secretion clearance. So what I'm going to do is show you the equipment that we would use for open suctioning, as well as demonstrate the clean technique in order to keep your catheter as clean as possible while you're performing the technique. So we've already reviewed the equipment on the wall. We have our suction hooked up here to a mouth yonker that we'll keep nearby in case we have to do any large suctioning of the mouth prior. So what I'm going to do first is I show you here I have some equipment. I have a pair of clean gloves. Now, normally I would not be lying that on the patient. This is just for demonstration purposes. I have a sterile suction catheter here. I chose the 10 French. I have some muco lube opened up because I do want to lubricate the end of the catheter to help facilitate easier passage through the nair. The other thing that I could use as well, if I didn't have the muco, is using sterile water to lubricate the catheter as I insert it. And I'm also going to use the sterile water for flushing the catheter after each pass with suctioning. I'm going to want to keep my right hand clean. So I'm going to prep my equipment before I put my gloves on. So I'm going to do hand hygiene. I'm going to prep my suction catheter with just the suction tip exposed, or the suction port exposed, and my suction tubing attached. I'm going to leave the rest of it in the sterile packaging. I'm going to now do hand hygiene again. I am going to put on a clean glove on my right hand, and I'm going to try to avoid touching anything else with my right hand. So what I'm going to do is just tuck the suction tubing under my arm or in my hands, just like that. With my left hand, I'm going to pull the sheath off and keep the tip of that nice and clean. I'm going to wrap that in my hand just like that so that I'm not touching anything else. And then I'm going to then lubricate my suction catheter. So I'll have my assistant here hold and lubricate the end. Okay, I'm nicely lubricated. I'm going to come up And I'm going to then insert my suction catheter into my patient's nares, and might meet a bit of resistance. You don't want to be too forceful. And you're going to go until you basically stimulate a bit of a cough or you meet resistance. You're going to apply suction. You're going to withdraw, kind of twisting. And then once I'm done suctioning, I'm going to come over here. I'm going to apply suction and get my catheter flushed. I'm then going to take my right hand to the tip of the catheter, and I'm going to roll that in there and give my patient a little bit of time to recover and determine whether or not I need to repeat those steps again. Okay? If I don't need to repeat those steps, I will just then roll the catheter all in my hand like that, take my finger under my glove, and everything's in there, and then drop that in the garbage. I have 3 pediatric and neonatal size suction catheters. These are Y adapter types, and I will demonstrate what I mean by that when we're setting this patient up for suctioning. And then I have a 12 and a 14 French catheter that are built for bigger children, your teenagers and adults. They have a different connector. It is the double swivel elbow connector that's available to use as well for those bigger patients. We have our child here who is intubated with a 5.5 endotracheal tube. So the rule of thumb when selecting the proper size of catheter for your endotracheal tube is to just double the size of your diameter of your endotracheal tube. So in this case, it's a 5.5. It's going to be 11. So we could go anywhere between a 10 and a 12 with this child. Ideally, the bigger the better for bronchopulmonary hygiene. But what I want to do to demonstrate to you is the Y type of catheter. So I'm going to choose the 10 French in this instance just to demonstrate the Y adapter. I've opened the 10 French Y adapter closed suction system, and in the package itself are 3 Y adapters. And these adapters are graduated for the size of the endotracheal tube that you have in place. So in the package we have a 4.5, a 5, and a 5.5. This child is intubated with a 5.5 endotracheal tube, so I am going to choose the 5.5 adapter. And then I'm going to prep my suction catheter with the adapter before I go over to the patient to put it in line. So I'm going to take my Y adapter here, and I'm going to take my suction catheter here. The suction catheter is going to attach to the small port on the Y adapter, just like this. Okay, so look, that's your connection there. This is my installation port right here. So this is where we're able to deliver liquid medications, or if we ever wanted to flush our catheter, we can use our saline nebule to help assist with suctioning and flushing our catheter after use, and it would just attach just like that, and then you would squeeze it down to the catheter so we can remove secretions from the catheter. After we've attached to our adapter and we've checked out our installation port, we now want to check and make sure that our suction trigger works. So you can see there I am able to depress it. That's how I'm going to be able to apply suction to the patient when I'm withdrawing the catheter. And then I have a cap here where my suction tubing is going to attach there. And then it's very important to try to keep these caps nearby so that we can recap after we're done suctioning our patient. Okay. The other thing is a built-in safety is we can actually lock the suction trigger so it doesn't get inadvertently depressed. So it's just a lift up and twist, and then you can see I can't depress that now. So on the suction catheter, you'll see that there are actually centimeter markings as well as color markings on there. Okay, so you can use that as a guide for your suction depth. The other nice thing with the centimeter markings is you can actually line the centimeter markings up with the endotracheal tube. so that you know that you're not suctioning your patient too deep and causing trauma to the lower airway at the carina. So here's our intubated child. The tube is nicely secured. And what we want to do is we want to switch out this endotracheal tube adapter for the Y adapter on the suction catheter. So it's very simple to do, but I'm going to have my assistant here hold the tube. We recommend anytime you're manipulating the tube that it's done with 2 people in order to prevent an unplanned extubation with your child here. So as she's holding this, I'm just going to take my thumb in my hand and remove the endotracheal tube adapter here. It's a good idea to keep this nearby in case something goes wrong where you might need the adapter. So a sterile container, like the orange top sterile container, is a good place to put that into to keep it for safekeeping. We're then going to grab our inline suction with our Y adapter. Again, remember we have a 5.5 endotracheal tube. I have my 5.5 adapter, and then I'm just going to fit that on to my endotracheal tube and make sure that that is snugly fit. Because we highly recommend this to be a 2-person procedure, my assistant is actually holding the endotracheal tube with one hand while she's maintaining positive pressure ventilation. And then I am going to now suction my patient. So this tube is actually 26 centimeters in length. So in order for me to determine the proper depth of insertion, I'm going to add 5 centimeters to that length. So 5 plus 26 is 31 centimeters. That is going to be the maximum depth that I'm going to go with my suction catheter in order to ensure that I'm just going beyond the tip of the endotracheal tube. So I'm going to remove my cap from the end of my suction port. I am going to unlock my suction and then just give it a quick depress to make sure that we hear a little bit of suction. And then what I'm going to do is I'm going to identify where 31 centimeters is on my suction catheter, which is right there. And then as I advance it, I want to advance it to as far as this observation window down here. That's where you want to look for that 31 centimeter marking. So as my partner is holding and maintaining positive pressure ventilation, I am going to begin to advance my suction catheter through my endotracheal tube. The whole procedure of advancing and withdrawing the suction catheter should take no more than 10 seconds. Okay, so as I advance, I'm watching for that 31 in the observation window. You can see as I advance, I'm pulling back on the sheath. And now, if you look, you will come here and see in the observation area, you're going to see 31. So that should tell me that the tip of the suction catheter is right at the tip of the endotracheal tube in the patient's lungs. So now I'm going to apply suction, and as I withdraw the catheter, you'll start to see secretions come up the catheter. And then what you want to do is see as you get towards the end there's a little black marking right there just below the observation window. That's the end of the tube of the suction catheter. You don't want to go any farther than that. Otherwise, you're going to pull it right out of the catheter hub.